Hey folks, Jamie Stokes here. I usually do videos on real estate, but today I'm going to do a video on monkeypox. So I know San Francisco has declared a state of emergency due to monkeypox. There's lots going on the subject. I think World Health Organization declared it the next pandemic. It does seem to be there's one thing after another. You know, if it's not COVID, it's monkeypox or something else. So I've already been vaccinated for it. I noticed that the news portrays it as being, um, an issue among the LGBT community. You can add whatever extra letters on there you want. I don't want to leave anybody out, but it's not just uh, an issue in that community in itself. There's a lot of people who are of different sexual orientations. So, if you don't have a faithful partner, if you have an open marriage or open relationship, it can be introduced that way. There's bisexual men and women, so it can be spread through bodily fluids. It doesn't have to be sexual. If there's somebody has sores and they've been scratching and they touch something and you touch it and then you touch yourself, then you can get it that way. It's being identified as an issue in the LGBT community, but it's not just in that community. I don't know why the news really is portraying it that way. It's kind of, I think it's kind of offensive, to be honest. But it's not just an issue in that community. There's there's different cases. I think the first ones in Canada started in Montreal that I'm aware of. It's spread all over the U.S. It's in different countries, as far as I know, and it's become a huge problem. So, if you go out in public, if you touch anything, these are just my thoughts on it. I'm not a doctor or anything like that. But if you touch anything or there's um, any transfer of anything really where you're touching and there's bodily fluids or anything like that, I would have concern about it. It could be another pandemic or whatever the doctors want to call it. It's not just centered on that community in itself. It seems to be kind of the possibilities out there for it to get into any community. When I got vaccinated for it, I noticed that there was straight couples there. There was, um, you know, different sexual orientations there. There was just random people, different backgrounds, different ethnicities. So it's not just, excuse me, it's not just one community that this is affecting. Don't be naive where to think it's just, among the gay community or something like that, despite the news seeming to portray it that way. I would get vaccinated for it. I'm not 100% on board with all vaccinations. There's been, when it comes to COVID, there's been a bunch of doctors and otherwise really healthy people dropping dead, and there's suspicion of that being a result of getting vaccines from COVID. There was I believe a 27-year-old doctor that died yesterday here in Canada from it. She was very healthy, no health issues that anybody was aware of. So, it does make you wonder and question things. There's a lot of just pushing to get vaccines, and I'm not one to push for vaccines necessarily. I do think vaccines are, I'm not going to say I'm against vaccines or anything like that, but I'm not 100% for them at the same time. So I'm kind of the mindset for you to do your own thing, essentially. If you feel that you should get vaccines, go ahead and get them. If you feel that vaccines aren't for you, I don't know what to say. I'm not going to tell you, oh, you need to do this or you need to do that, because it's not that simple. Everybody's got different health conditions or different issues, different faiths, beliefs, whatever. All I know is I've been vaccinated for it, and I decided, just based on what information is available out there, that this was probably in my best interest. Not that I go out and meet people or anything like that, but I think based on how it's spread, I think that it's kind of in everybody's best interest to get it, and that's just my 2 cents. Like I said, I'm not a doctor, so it's up to you to research things. I haven't done an incredible amount of research on it or anything like that, but I just think that this could potentially be a problem. Mind you, I think that a lot of things are also blown out of proportion. I don't know what the numbers are. I think there's 740 something cases in Canada total right now. I don't know at the rate in which it spreads or anything like that. I know how it's spread, but I don't keep tabs enough to say that you definitely need to go get this or do that. I mean, I'm not a doctor, so you shouldn't be following my advice anyways, and I don't really have an opinion on it just because I'm not a healthcare professional. So this is just me, I guess, basically talking about getting the vaccine, why I chose to get it. And the reason's really quite simple, just because of how it's spread. You don't have to have sexual relationships or anything like that with people in order to get it. Close contact, basically just touching each other pretty much from the sounds of things. So that's kind of scary. We need to be kind of mindful of our own space and things like that as well. So if you're thinking about getting the monkeypox virus, it's only I think it's only for certain individuals right now, if you identify as being part of one of those groups. But it's important at the same time, I think, to be careful and not take risks with certain things. I don't want to tell you how to live your life either, but the monkeypox virus is definitely becoming a thing. It's going to be a global thing. It's going to be a North American thing, and it's not just going to be part of any certain community. It definitely has the potential to spread to basically anybody. I don't know where it originates from, but I think if you're out and about, and if you do have an active sexual lifestyle, I think that's probably something that you might want to look into. I don't, and I still got vaccinated for it, so you can't say, oh, it's just part of the gay community and it only affects them, and they should be careful because they're sleeping around with all kinds of people or something like that. That's definitely not the case, I can tell you that. But it does, it can affect people just basically through touch. I mean, they talked about it being on bed sheets or different surfaces and stuff like that. So I mean, I'm not going into anybody else's beds or doing anything crazy with anybody or meeting anybody, but that's something that you need to be cautious of, I think. So statistics for it, I don't know. Like I said, I don't know what the spread rate is or anything like that. I think I've read a story from somebody who did contract it, and they said it was awfully painful, and they got sores, and it was itchy and painful, and they described the process for getting vaccinated for it. And I guess this was in the U.S. So it's definitely spreading. It's becoming a global concern right now, and I've got my vaccination for it. That's not to say that you should or you shouldn't, but I have concerns about this being another pandemic type thing, just because they had COVID going on, and it seems to be it's COVID 1, COVID 2, COVID this, COVID that, then it's monkeypox, and there's constantly something out there that seems to be threatening our health. I think statistically every 100 years we have a plague type scenario, a serious public health thing that affects or kills an awful lot of people. Every 100 years there's something. There was Spanish flu in 1918. 100 years before that there was something else. 100 years before that, I'm sure there was something else. I'm not a doctor or involved in that type of information, but I mean, you can search it up. I think every 1,000 years there's something major, and every 100 years there's something major. I do think some vaccines are definitely good. You look at measles, polio, different things like that. Our childhood school vaccinations. Through these programs, some things have been eradicated. You don't hear. I see a lot of people just saying, "Well, I don't trust vaccines, so I'm not going to get vaccinated." Well, I don't 100% trust vaccines either. I don't know what's in them. I'm not a doctor. We're told by healthcare professionals to get them, and they're more educated in health than I am. So I can't see there being a conspiracy among the world's healthcare professionals to, off half of the public or something like that by taking faulty or vaccinations that are going to kill everybody. It just, kind of seems absurd. I mean, you can talk about the Great Reset and the global elites and things like that, get into your conspiracies or whatever, but I just think, there's no way that it's plausible that this many healthcare professionals are on board to do this with the public. So, if you feel that you should get a vaccine, I've gotten mine. I didn't get sick from it. I didn't have any issues. I'm also immunocompromised. I've had 2 transplants, and I still decided to go and get that. I've had 2 of my 4 COVID shots. I don't know if I will get any more. I'm kind of concerned seeing, there was people dropping dead, and they're saying that it's, might be COVID related or something like that, but who really knows? And at the same time, um, it's supposed to really help you out if you do catch COVID, not necessarily prevent it, because people are saying, well, I'm getting my first, second, third dose, whatever, and I've had COVID twice or whatever. I don't know. I haven't had it, and I'm immunocompromised. I don't know what you people are doing out there to catch COVID twice. But be careful, be wary of things. Not to say don't live or lock yourself in a room for the rest of your life, but be cautious with things. If you want to wear a mask, I don't wear a mask out in public. If you want to wear a mask out in public, knock yourself out. I'm not going to look at you sideways for it. I'm not going to say, well, yeah, that's ridiculous. I've had people say that to me in the past when masks were mandatory. Well, I'm not following this. This is the government's plan for this and that. Just trying to do this to people and whatever. I had a lady stop me in a plaza one time, and she just started yelling at us. I was with one of my neighbors, taking him out grocery shopping and stuff. And she stopped us, and she's like, "Oh, I was just in the bank, and I'm not." They asked me to put on a mask, and I said, "No friggin' way am I wearing a mask." And she's like, "You guys should stand up for your rights." Well, I don't think it's about rights for me. I think the general public these days seems to have an opinion of, I don't want to do this, and there seems to be a very rebellious thing, which I don't think necessarily is negative. But I think as part of the community that we have a duty of care to everybody else as well. We can't just look out for ourselves and say, well, I'm not allowing my rights to be trampled on. I'm not going to wear a mask because I don't feel like it, and I'm not doing what the government or anybody else tells me to. I don't believe in COVID. Well, I saw a few people that were saying that originally, they don't believe in COVID, and there was a few people on radio shows I know that were dismissing COVID and actually died apparently from COVID, or so that's how the story goes. Conspiracies, yeah, I don't. I think some conspiracies over the past few years have started to become a reality. I know Trudeau said we're not going to have vaccine passports, and here we had them. I think it was like a month later. We had vaccine passports. So I don't totally trust everything that's going on, but we really need to look after our own health and do things not just for ourselves. We need to take care of ourselves and everybody around us too. I know COVID made things really difficult for a lot of people, but financially and otherwise. But monkeypox, it's becoming a serious thing, and I've only had, like I said, 2 of my COVID vaccinations, despite being immunocompromised because of my transplants. I take immunosuppressants every day, and I've still only had two of my COVID shots. Like I said, I don't know if I plan on having any more, but um, I've got my monkeypox vaccination anyway, and I believe that the monkeypox vaccine has basically has similar or the same components as smallpox or something like that. Feel free to research it up, but you know, I encourage you, if you're the type of person who believes that maybe this is in your best health and interest, or you're kind of fearful of catching it. You know, let's not spread hysteria here and freak everybody out. But if you feel that you should get it, go for it. There's no right or no wrong answer. You know, I don't feel sick from it. I haven't grown any extra limbs or anything like that. So if you do believe that you should get it, go for it. I got it just because of how it's spread, you know, and I don't have any concerns about, you know, because one of the things they said was, you know, if they have sores and they've been laying in bed and you share the same bed sheets as them or something like that. I'm not out doing that, so I don't really care. I'm not hopping into nobody's beds or nothing like that. But, you know, if you do, I would say, you know, I'm not going to judge anybody based on anything. It's none of my business what you do with your life, or in the privacy of your own or somebody else's home. That's your business. But if this is something that you are doing, knock yourself out. Go get the vaccine for it. You know, you don't. From the story that I read from this guy in the U.S. that had it, he said it was awfully painful and he had issues getting treatment for it. So it doesn't sound like something that I would want to catch. I believe that it's better to be vaccinated for things before you catch it. Being immunocompromised, it's easier for me to catch different things, you know, even colds or flu or anything like that. But I take my immunosuppressants. My transplants are working not 100%. They're actually down. I've had them for years now. My pancreas, I had a pancreas and a kidney. My pancreas failed and my kidney is down. I've had that for over a decade now. So it's not working as efficiently as it should be, but it's still there. I think I encourage people honestly to go and get their monkeypox vaccines. You know, in Canada here, all you need to do is go through the health department or whatever and make an appointment to go get your monkeypox vaccine. You don't have to pay for it or anything like that. I don't know how available it is to you or your in your area, but phone the health department and at least inquire about it. You know, the stories coming out about monkeypox and how much of a concern and how fast it's spreading is kind of concerning. You know, I'm going to call them conspiracies. I don't know enough about it, but I heard that monkeypox came out of Wuhan, same place as COVID did. I don't know if there's any truth behind that, and I don't want to blame anybody or say it was intentional. I mean, it sounds like it, but at the same time, you know, I don't want to get into conspiracies because I'll get everybody all riled up in their conspiracy theories, and you know, we'll call them conspiracies whether they are or not. I know somebody said something years ago that if they were basically going to take over certain countries, that how they would they would spread a virus, you know, and make people sick, cause global issues or whatever. I'm not going to say that that is the case. You know, I heard that there's even from Donald Trump. You know, I heard that there was very poor conditions in these labs, and there wasn't the proper precautions being taken for these things to escape from the labs. So, you know, I don't know for sure. I haven't been there. I haven't looked at things, but I mean, if that's the case, that's pretty alarming. At the same time, it's it's a possibility. I mean, who knows, really? But we're not going to get into that too much because I'll just get everybody going on their conspiracy theories, which, as I said earlier, you know, aren't all negative. You know, some of the things in regards to conspiracy theories over the past few years have actually happened. You know, I'll make another video at some point about the food supply because I think that's that is definitely, it's not a conspiracy, in my opinion. I think they're creating a food shortage. And like I said, I'll make another video on that. But monkeypox, it's becoming a worldwide issue. I suggest getting vaccinated for it. I don't think they're 100% sure that the smallpox vaccine or whatever it is that they're using is making it so that you necessarily are 100% protected against it. I don't know what the risks are of taking the vaccine, but I've taken it. I'm immunocompromised. I'm still here. I didn't get sick. I've had 2 of my 4 COVID shots. I haven't been sick from either of those. I haven't contracted COVID. Somebody close to me did have COVID, and I visited them without knowing, and they didn't know at the time either, and I didn't catch COVID. So I'm not going to say that everybody will be as fortunate as me, but go out, do some research for yourself, get credible sources, and see if you do want to catch monkeypox, because this is becoming a serious issue. There's so much going on in the world right now, and we really need to be cautious of ourselves and our health and things like that. So when it comes to monkeypox, I'm going to say go get the vaccine. You don't want to end up with monkeypox. I haven't had it, so I don't know how bad it is. But based on this person's account of how they felt when they got it, I don't want it. I'm good, thank you. So go get your monkeypox shot. Take care for now. Check out my other videos. They're housing market related and on different subjects regarding housing. And I'll make some other videos as well. Another one will be in regards to the food shortages. Maybe I'll do that one next. Who knows? But take care for now. Check out my other videos.